Assalamu alaikum. Miss Aisha, can you hear me? Am I audible?
जी, अस्सलाम वालेकुम सर, यू आर ऑडिबल। सर
Okay
कैसे
जी।
हैं आप?
अल्लाह का शुक्र है, ठीक ठाक। Thank you very much. So shall we start?
सर 5 मिनट वेट करते हैं ऑडियंस का, उसके बाद इंशाल्लाह वी विल स्टार्ट एट 6:05।
Okay, sure.
सर सर आप काइंडली क्लास स्टार्ट करवा दें।
Assalamu alaikum. Assalamu alaikum, sir. Am I audible?
Yes, you're audible.
Okay, myself, Aisha Shehzadi. First of all, I want to say thanks to all of you for joining us and a special welcome to our speaker, Dr. Shahrukh Ali. So we will begin this session with the recitation of Holy Quran. So for recitation of Holy Quran, we have Hafiz Muaz bin Zahid with us. Hafiz Muaz, can you hear me?
Assalamu alaikum. Yes, I am hearing you. Okay. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. يا أيتها النفس المطمئنة ارجعي إلى ربك راضية مرضية فادخلي في عبادي وادخلي جنتي صدق الله العظيم.
Jazakallah, thank you so much, Hafiz Moaz, for the soulful recitation. So, without any further delay, let me introduce our speaker of the day. So, today we have Mr. Shahrukh Ali with us as a speaker. He is highly qualified healthcare professional, currently serving as senior pharmacist at Dr. Suleiman at Dr. Sulman Al Habib Hospital in Riyadh, Saudi Arabia. With over a decade of diverse pharmacy experiences, he has led in multiple roles, including pharmacy operations, satellite pharmacy in charge, stock controller, and clinical pharmacist. He is a registered pharmacist in Pakistan, Saudi Arabia, and Australia, which reflects his commitment to maintaining the highest professional standards across different healthcare systems. In addition, Mr. Shahrukh is a certified antimicrobial stewardship pharmacist and a certified qualified quality improvement pharmacist. His key areas of interest including medication safety, clinical excellence, and healthcare quality enhancement. We are truly honored to have him with us for today to share his expertise and his experience of pharmacy practice during Hajj. Without any further ado, over to you, Dr. Sharif.
Well, thank you so much, Ms. Aisha, for the introduction. Uh, Before starting, I just wanted to tell you that I'm working currently in Dr. Salman Habib Hospital as a senior pharmacist. So let's start this session. Uh, my goal is to just inform you all about. I don't have any presentation, so sorry, because I believe in delivering my point through my own words, not through some presentation. So that is why I have not made any presentation, and I don't think so this topic needs any kind of a presentation. So basically, a Hajj mission, which is organized by the Ministry of Hajj and Umrah from the Kingdom of Saudi Arabia, as you know, every year in Zil Hajj, and pilgrims from the different countries come to perform Hajj. Since different countries people are coming, on the other hand, they want different healthcare professionals to come over there and to serve the pilgrims. For that, they have usually call out for the applications. They have made some contract with the government and private hospitals. So here we have in Saudi Arabia one of the biggest hospital like Dr. Salman Al Habib Hospital, who take the applications from the employees actually, and they send us the email that if you wish to work as a healthcare professional during the Hajj season, you need to send us the applications. So that's how I applied through in this Hajj mission, and finally I got selected, and then they took me to Hajj. So basically, we have, if you want to apply through Pakistan, you can also apply. We have two different kinds of processes. First of all, you can go through the medical mission, and second is voluntary organization. By the way, we are following these two pathways in the Kingdom of Saudi Arabia as well. You can either go as a medical professional or either you can go as a volunteer. So what's the difference between the two of them? First of all, if you will go as a medical healthcare professional, then of course you are getting paid for your services, and second of all, that you will serve as a as your expertise. Like if you are as a pharmacist, you have to deal with the pharmacy things, and if you are not in the pharmacy or any other healthcare profession like nurse, doctor, you have to do your things. But as far as the volunteer pathway is concerned, the volunteers pathway is not paid. You have to go by yourself, and then they can give you any role, like either as a healthcare professional or as a paramedic or as a non-healthcare professional. So you have to do anything in that way. So these two pathways we are actually following there. So apart from applying, you know that in Pakistan that there are the government websites are there. Government hospitals are usually taking the applications for these. uh, you can apply through any government hospital, or there is a website as well, as if I'm not sure about it. You can google it, and then you can apply for your application. Okay, so what is your goal? A pharmacist in the official pharmacy Hajj medical mission plays a much broader role than a typical hospital pharmacist. During Hajj, pharmacists are part of multidisciplinary healthcare team providing care to tens of thousands of Pakistani pilgrims over a short period under one of the world's most demanding mass gatherings. So, as you listen to me, that in this Hajj mission, what we have done that when we went there, basically we have different clinical sites. Let's suppose in the Mina camps, we have like more than 74, more than 74 or more than 80 camps. So we are just considering about Dr. Suleiman and Habib have, in each camp there is a different clinic. Okay, so in this different clinic we have a nurse and a doctor who is serving for the patients. Okay, like let's suppose if we have 74 different clinics, we need two different shifts, morning and nights. Morning shift is like for 12 hours and night shift is for another 12 hours. Okay, first we have to set up these clinics. Of course, when you will go, you will not find anything inside. You have to arrange a clinic according to the clinic itself. Okay, so you have to arrange stethoscopes, you have to keep the dynastat over there, you have to keep a table, a chair is already provided, only that, and all the things we have to keep it. Okay, you have to give the crash card in each and every clinic, which is also a very big thing. Like 74 clinics if you are serving, you have to bring from we have to bring it from, of course we don't have enough stock in Makkah, so we have brought a different stock from different branches. We have different 6 and 7 different branches of Dr. Suleiman Habib. We brought it from there. We have put one crash card. There should be a sharp container for discarding the needles and everything, and then there should be a proper sense of medications. Okay, now when it comes to the medications, this is a duty of a pharmacist to supply the medication first of all. So first role for the pharmacist in the Hajj mission is to supply the medications. Now, what kind of a medications you are being provided by the government, okay, or by the sponsor or by the hospital? There are three different things. Okay, in this kind of a Hajj, basically when we are applying and we are providing the services, we just provide the basic care service. This is the main important thing. We are never giving them the secondary care, or we are just providing them the primary care, in which we are dealing with their primary symptoms. Let's suppose if a patient is chronic, if it comes to you and he tell you that he's suffering from shortness of breath or something like this. So whatever you can do, that you will try your primary things. If you think that he cannot be able to you cannot be able to manage it, you will definitely going to transfer them to the hospitals. Of course, Makkah has different hospitals, and they will transfer to that place. So after arranging everything, you have to provide the supply of medications. So first of all, you have to develop a store, and that's what my job is over there, to form a store. Okay, so from the things they provide me, they just ask me to go there. There is a room, and that room is full of medications. First of all, what I did, that I arranged all the medications according to the alphabetical order, so it will be easy for me to dispense, and to avoid any dispensation error, I have to arrange everything. I arrange everything so that I can work. By the way, I am only one alone pharmacist in the Hajj mission. There is no other pharmacist over there. Okay, so when after arranging, then you have to send the backup and send up the medications for 70 more than 72 clinics. So it's also a very big task for me. So after sending the medications to them, of course, then these medications will be consumed within hours. It will not be enough for one day even, because the patient influx is so high, because there are the too much patience. And if I will tell you, like in 10 days, we went for like 10 days, and in these 10 days we have more than 84,000 patients have visited our clinics, including all the MENA camps. So After sending all the stocks and everything, when the patients have completed their when they come in the MENA, then this is the time that they start visiting you. Okay. So, and the role of a pharmacist is, number one is the medication dispensing. Okay. Then second is the clinical pharmacy services. If you have more than like, I wish that if I have more than one pharmacist, then definitely I will go for my clinical pharmacy services as well, because when you are dealing with the patients, sometimes the clinical pharmacy is required to do the interventions. Like you can do in this one the patient counseling. You can identify the drug interactions, recommended the dose adjustments if it is necessary. But usually, since we are providing the primary care, it is not very much required. So that is why they took only one pharmacist from them. The patient counseling is very important. Like usually the patients will come to you is of the like allergic rhinitis. They will be having the viral infections, because a lot of people and a lot of gatherings over there. So the most medications that I have dispensed to them is loratadine. The loratadine stock is like we have yani more than thousands of boxes for the loratadine, but it got just finished in one day. So you can imagine that how much loratadine we have consumed for the patients. Okay, apart from loratadine, we have brufen, we have paracetamol. Okay, and we have normal saline for irrigation purposes if they have bruises or anything, that we can do the dressing. And then we have gloves, we have like everything, surgical and medical items. Surgical items should not be dealt by us, but because we don't have staff, so we deal both of the things. And then we have like a dynastat, we have blood pressure machine monitoring machines. And like in the medications, mostly we have loratadine, we have brufen, we have panadol. Okay, then we have a few boxes for Voltaren injections as well, if for the patient is not suffering from a chronic pain, so that we can use the Voltaren injection. Then we have like amlodipine, if some patient miss their doses for this one, so we have some boxes for that as well. Then mostly we have the oxygen mask, because most of the patients are coming with such conditions, so we need to nebulize them as soon as possible. So we have atrovent nebulizations, we have ventolin nebulizations, and such kind of things that in the primary care setup you need. Okay. Apart from that, a third thing that pharmacist role includes is the medication supply management. Okay, which includes the forecasting medication demand, inventory management, like we are doing in our store, maintaining the cold chain medicines, coordinating the medicine distribution across clinics. Okay. Then for the emergency response, we have, as I've already told you, if there is a code blue happened, then the pharmacists who are going for the Hajj is must be CPR trained. Okay, they can be able to do the CPR. I know that there are nurses and the doctors as well, but you don't have to rely on any of them. You must know how to do the CPR. Okay, so CPR and BLS is the primary need that you need to have when you are going for the Hajj. Okay, apart from that, I missed one point, that you should be vaccinated. Then they will only select you. Vaccinations are for COVID, for the meningitis, okay, and for influenza. These three things are very important. Even I took my influenza vaccine. After that, also I got the flu. So it's very important for you to take at least these three vaccination. Then the government will select you, or if you are in Saudi Arabia, then the Saudi Arabia will select you. Before selecting, they asked me to complete my vaccinations. If I would have not completed my vaccination, then definitely they are not going to select me. Okay, so this is very important. If you are going to Hajj, you should complete your vaccinations before that. Okay, so we were talking about the CPR or BLS. If you find the code blue, for the basic care you need till the ambulance arrives and take the patient to the hospital, you can do the CPR for the patient as well. Before, there is an example that a pharmacist went there, and we don't have so much clinics. Before, what we are doing, that we have different sites like medical centers. Like in the Agahan, we have the Clifton Medical Services. We have a small medical center like this, which have a laboratory, which have a pharmacy like this. So now we didn't do like this. Now we have different clinics. Like if MENA have 74 camps, then 74 clinics were formed there. So now there is a different thing. So staff also we need more than yani, like 74 staff. Let's suppose we must have more than 200 staff, but we didn't take so many staff. We have shortage of staff as well. Some staff have duty from their 24 hours, like they don't have anyone to replace them. They slept in the clinics as well. So there were the difficulties as well, but yeah, it's a very different and good experience. So the common conditions that we encountered as a pharmacist is a heat exhaustion and dehydration. As you know that in Makkah the temperatures during the Hajj time raise very high. It goes like 45 to 46, 47 degrees centigrade as well, and the people are in the scorching heat, and they are going definitely the things were provided to them, like the for water for the hydration, and they were continuously, they have the humidifiers to keep them to keep the humidity across the Hajj missions to balance and to not feel them very warm. So heat exhaustion and dehydration and a heat stroke is one of the most primary cause that the patients are coming with. So for that reason, you must have cold compressions, okay, so that you can cool down the patients. You must have the medications like paracetamol, and you must have ice compressions. So these are the primary care things that we can give to the patients. Second is upper respiratory tract infection, as I discussed about the allergic rhinitis. Then we have to prescribe them the one start dose of brufen, and then the antihistamine medications. Then the gastroenteritis is one of the most common cause that we have faced during the Hajj mission. So we have Ryzik with us, and we dispensed them Ryzik to take them before breakfast. Okay, then diabetes complications. Diabetes complication is usually the patients are coming with already diagnosed diabetes. Then we have we have some insulin pens. If they miss their dose, we can dispense it to them. Then hypertension. For hypertension, we have amlodipine. Then asthma and COPD exacerbations. For this one, we have nebulizations. Musculoskeletal pain, we have Voltaren injection. Skin infections, yeah, for the skin infections, a lot of people are coming with the burns. Okay, why burns? Because of course they are in the scorching heat and they will get the burns very easily. Some people are not wearing the proper kind of slippers, so it is very important that if you are going for a Hajj mission, please buy the slippers from the good brand, so that they will not hurt you in your foot. So a lot of people are coming with the foot infections for because of wearing the slippers, and then a lot of people are coming with the burns, skin burns. So we have a halo 4 cream, silver sulfadiazine, that we are giving to the patients. Okay, so topical creams we have a lot, like we have moisturizers for the Mibo, and we have fusidin cream, okay, for the bacterial infections of the skin. So these also we have deal such kind of conditions as well. Then we have allergic reactions. Allergic reactions patients we don't have so much, because we are just providing the primary care. And then minor trauma. Yeah, I will share one example with you that when I was serving in the store, suddenly my head of the department from the Hajj mission, he called me and he said he wants me to visit the female camp. First of all, I was very shocked that how I will go to the female camp, but he said me that no, a female volunteer will help you. You have to go there and you have to check. There is a female over there who cannot breathe properly, and she has a problem. Then okay, I went there. When I went there, I met her. She was literally not feeling well. She doesn't have any fever or some kind of a thing, but she was not feeling not breathing properly. Her breathing pattern was disturbed. Then I try to check her mental status, that if she's working, if she's doing fine at that time or no. So I found everything is okay. Then I asked her that what happened, that why you felt like this. Then she informed me that somebody from my back shouted, and I felt like feared. I developed fear. So I immediately thought that this is a panic attack, and there is nothing that we should do. If she felt in the same way, then we have to transfer her to the hospital. Then I asked her to just relax and just try to take some water or something. If you feel anything not correct, you can anytime visit our clinic. Then I inform her relative as well, that if she's feeling in the same way, then we have to take her to the hospital. So this is the way that you have to counsel the patient, that because we are just providing the primary care in this Hajj mission. Okay, the major challenges that we have to face during the Hajj mission is the extremely high patient volume. Okay, obviously that if you have 74 clinics, you have to dispense the medication for the 74 clinics. Then you have to refill them again and again, again and again. And at that point, any time they have to come, because the clinics are for 24/7. Okay, and they can come at any time. So you need at least 4 or 5 pharmacists, first of all, to develop the store, second of all for doing the quality checks, third of all for the replacing the staff so that they will not feel exhaustion during the duty and during the shifts. So this is the one more main thing, because we required speed, accuracy, and excellent prioritization. So for that we need more staff. Okay, there were language barriers. That's why we usually give the applications to the different countries. If you see the Ministry of Hajj and Umrah website, when they are taking the application, they are asking your country and the languages you can speak. So of course, the main language that we spoke there is English. But apart from that, there are different people who cannot be able to speak English. So we have to face with Urdu. Of course, we can speak, but Punjabi, Pashto, Sindhi, Balochi, Arabic, English. There are different people were there. Okay, some people were speaking French, some people were speaking Persian, so it would be very difficult. So clear communication becomes essential to avoid the medication errors. Third challenge that we have to face is the elderly patients. Whenever you have to deal with the elderly patient during the Hajj mission, it's a task for you, because to first of all to take them from here and there and to bring it them to the clinics, then from prescribing the medications concerning their core morbidities is a very difficult thing. So many pilgrims have the multiple chronic illnesses, take numerous medications, have impaired vision or hearing, need repeated counseling. So this would be a challenge for us, because we need to take care about the drug interactions as well when they are taking the different medications from the home. And if we will prescribe anything new, we have to take their history as well. So what we have done that during our patient's visit, we have generated a software in which we are taking the patient passport number, patient age, and patient history, and then we have just a form just to what medications that we have given to them, so that in the last we have completed the census, and we will see that how many of the patients that we have seen in this Hajj mission. So then we have extreme environmental conditions, in which the challenges include temperature often exceeding to 40, more than 40 degrees centigrade, as I told you before, longer working hours, fatigue, maintaining medication stability, managing cold chain products. Okay, then we have limited resources, obviously, because when you are not working in a hospital, this is a primary care setup, and you sometimes you have the medication stock get finished. There is a demand for giving us the more stock for loratadine. All the clinics and all the doctors and all the nurses, they are just asking for the loratadine, but the thing is, because of the consumption going very high, our stock got finished. So that is why we faced a lot of issues because of the less number of stock for the medications. Then one of the major tasks for us is the infection control. During this Hajj mission, there is an audits as well, like the audits. Yes, the audits that we are facing in our hospital, same audits from the Ministry of Health. The people was coming from the Ministry of Health, and they are checking that everything is maintained as per the quality standard. So that is why we need one quality pharmacist as well in the Hajj mission to check that whether everything is on the place or no, whether the sharp is wasting on a sharp containers, whether if there is a blood products, it should be dispensed on the biohazardous container. Okay, if everything is getting monitored, if there is a fridge over there, it is getting the temperature for them is getting monitored or no, the instruments are working fine, if they need anything. So a quality pharmacist is necessary. Okay, so this is the we are lacking quality pharmacists, so we got, I think, fines as well, because of the because of the influx of the patients, nobody can stick to the rules. But the thing is, you have to uh, waste the sharp containers in the sharp. You cannot waste the sharp in the normal and ordinary waste. So these are the things. Harsh presence increase the risk of respiratory infections, influenza, COVID-19, meningococcal disease, and gastrointestinal infections. Apart from gastrointestinal infections, all the other required diseases required vaccination. That's why I discussed with you that the vaccinations are very important. So, key learning opportunities that serving during the Hajj provides unique professional development in mass gathering medicines. Okay, you have an idea about if there is a mass gathering, what medications that we usually use, because when the patients are usually interacting with each other, they can transmit the diseases from one to another. Usually, when there is a tuberculosis or something like this, so it can be transmitted very easily. So there is no vaccination, of course, for the tuberculosis. It can be spread from the droplet precautions. We have to take the droplet precautions for the tuberculosis. So yes, these kind of things. Then emergency preparedness. You need to be experienced in disaster planning, rapid response, and crisis medication management. Leadership is very important because when you are developing a store and you have to dispense the medication, you have to develop a pathway that how the medications are being delivered to the clinics. Then there are the logistic team over there that the logistic teams are taking the basically what I have created, because since I was alone in there, I have just created the bins for the medication dispensation. Okay, and then I was making the bags as per their need, and those bags were transferring to the clinics by using the we have the golf carts. We are using the golf carts to transfer the medications because in the MENA you cannot drive the car. You cannot, even the ambulances are very much limited mobility because of the traffics and roads are closed in all the Makkah. Even where first we were living in the same accommodation as the Hajis, where the Hajis were living. So, but then we were transferred to the another accommodations which is far away from Mina. So, coming from Mina to the from our hotel to Mina will also cost us a big time, because you know that. Usually the staff who is present there is of 12-hour shift, and sometimes they have to wait for 15 hours because it will take usually it takes like 12 minutes 30 minutes from hotel to Mina, but it took us like 3 hours, more than 3 hours sometime, because of the road closures. So yeah, you need to mentally prepare yourself that you have to stay in the clinics for more than your shift as well. Okay, you cannot demand anything over there that my shift is over, I have to go home, I have to eat. No, you have to sit. They will provide you everything, of course, for the lunch, dinner, everything is there in the camps. There are ice creams, there were free of cost cold drinks, there were free of cost food, everything, snacks you can take. But the problem is that you cannot be able to leave the clinic, because if you will leave, then the person responsible for the camp will complain for you to the Ministry of Health that there is no one in the clinic, and the patients, because the patients are not stopping, that you cannot even sit for 1 minute. The patients will there is a queue of patients outside, and they are coming again and again. Okay, even now when they know that the free services are provided, especially when Pakistanis are there, of course they will not leave anything which is which we are providing free. So in the Pakistani camps, you will see the queue of big people, and they are continuously coming non-stop. So of course we have to deal with those situations as well, that how to tackle a big crowd and how to tackle the shift between the staff. The staffs are getting were getting exhausted, and there were different scenarios. So yeah, so this is a very important thing, that you have to be patient when you are going for a Hajj mission. Okay, clinical decision making. Working alongside the physician and nurses strengthens the clinical judgment and interdisciplinary collaboration. This is one of the key learning opportunities when you are going for a Hajj mission. Okay, then cultural competence. Interacting with pilgrims from diverse backgrounds enhances the communications and patient centered care. Okay. For the public health, you will get exposed to disease surveillance, infection prevention, health education, and medication safety on population scale. And of course, apart from that, personal and spiritual growth. Many healthcare professionals describe Hajj service as deeply meaningful because they care for pilgrims during one of the most important journeys of their lives. Witness exceptional gratitude and resilience, balance professional responsibilities with spiritual reflection, develop greater patience, empathy, and humility through service. Okay, what are the skills that makes a strong Hajj pharmacist? First of all, you must have some experience as a in pharmacy operations. Okay, apart from that, you must know the quality. How we will deal with the quality when we are going to the Hajj mission. Uh, you need to know how to manage the stock, how to work in an inventory. Okay, we don't have any system over there. Okay, apart from we have provided with the iPads. In these iPads we have only the software to record the patient. For dispensing and the medications from the store, we don't have any system. Okay, we don't if they I wished that if they will provide me some Excel sheet or some computer or something, so that I can take a look for it, that how many medications are being dispensed, and what is the threshold for the medications being dispensed, so I can order them in advance, that which medications needed in the more stock. from the different stores working in Jeddah, Makkah, Riyadh, Qasim, like this. So yeah, this would be a task for me as well. So you must know the inventory control. You must know how to deal with the quality. You must know how to deal. You must be patient, yani, for working for longer hours of shifts. So these are the challenges, and these are the values that we have to do during the Hajj mission. So yeah, that's all from my side. This is my experience. If you want to ask any kind of a question, you can feel free to ask.
Jazakallah, Dr. Sharif, for your incredible, insightful session. We are really appreciating you taking the time to share your expertise and knowledge with us. Now we are open for question answer session. If you have any question, please drop in the chat or simply raise your hand. We will unmute you.
I'm pharmacist from Pakistan. I'm working in Islamabad in hospital. So how is it possible for us to work directly there?
Well, for Pakistan, I think there is a website for the, I think, Ministry of Hajj or something like this, Government of Pakistan. You can visit. They have an open vacancies when there is a Hajj mission. I think before 2 months or 1 month, they have an open vacancies for the pharmacist, for the healthcare professionals who want to go. Basically, I met a lot of Pakistanis coming from the hospitals across the Pakistan. So I went and I asked them that how did you apply. So they informed me that our hospitals has generated the applications, and from that we applied. But apart from that, if you're not working in a government hospital and you want to go to Hajj mission, then of course there is a website there. I think yeah, this is the one, that Ministry of Hajj and Umrah for from government of Pakistan. So you can visit that website, I think, before 1 or 2 months, and you can easily be able to go apply. And if you are in luck, of course, definitely they will call you.
Sir, we have few questions in chat box.
Okay. How is technology improving pharmaceutical care during Hajj? Well, technology, we didn't have any technology over there. Honestly, if there is an improvisation of the artificial intelligence over there, a lot of our work will be easy, would have been easy. So of course, there was no technology. It was, yeah, yeah, we can take this idea in the future. We have already decided to generate some system for the inventory management, and we can use the Oracle PeopleSoft to dispense the medications. Okay, we can make one you know inventory system for the known as the inventory for Hajj mission or something like this, where we can monitor the medication, that how many medications we are dispensing. We can arrange the stock. Even if we need more stock, we can arrange it from there. Okay, even I have suggested them one thing as well, that beside every clinic, yani, if there is a nurse, if there is a physician, there is a pharmacist as well. Why? Because the pharmacy role is very important. They can help you in interventions. Okay, they can replace you. And by the way, I have done the clinics as well. When there is a doctor is not over there, and there is a time lapse between them to come, we cannot leave the clinics like this. So I left the store and went there, and I did the clinic as well. So there is a direct patient interaction as well. So being a clinical pharmacist, you can also do the consultations. The patients will come to you, and then you have to listen their symptoms, and according to that, according to their past medical history, you can prescribe them the medications as well. So this is one of the role that I forgot to inform you all. So yeah, the technology plays a very important role, and in the future Hajj missions, we are actually deciding to make improvisations, because this is the first time that we have dealt with so many clinical sites. And this is, I'm telling only about the Mina, that we have more than 74 clinics. Apart from Mina, in the Jamarat, we have also some sites. Then in the SAR, that is a Saudi Arabian Railways, we have also one clinical site over there. So yeah, different sites were there, and in different site there were different clinics. If you could give one piece of advice to PharmD students who aspire to work in international healthcare setting like Hajj, what it be? Like this question, I've already answered. There is a website for the Ministry of Hajj, Government of Pakistan. You can visit that, and there is an option for working as a volunteer or working as a healthcare professional. You have to select your pathway, and then the applications will be taken. But I think the one who is working in the government hospitals, then they have a more selection opportunity. Kindly tell the roadmap for becoming the clinical pharmacist in KSA. Well, this question is not included in the topic, but I can answer this. For becoming a clinical pharmacist, the Kingdom of Saudi Arabia required masters in the clinical pharmacy. First of all, then you must have gone through the residency. Okay, the residency should be completed in the Kingdom of Saudi Arabia. Okay, and then third, you must have the relevant experience. If you have the relevant experience, they will definitely be going to select you. But considering current situations, they are not hiring any non-Saudis for the clinical pharmacy. Okay, they are usually considering their own Saudi pharmacists, because they know that they have done their education in their own country. They have done their residency in the governmental clinics, in governmental hospitals, and then they can be easily be able to join the organization. But it's not like that. We have clinical pharmacists in our hospital as well, but they are not working like since now. They have been working like since 10 years or 11 years like this. So yeah, previously it was possible, but now becoming a clinical pharmacist in KSA is very difficult. But yeah, if your experiences are relevant, and if you have masters in clinical pharmacy, or if you have MPhil or something like this, then easily you can be able to do it. Just you have to pass the exam for the clinical pharmacy, and then you can apply through different websites. Dr. Suleiman Habib also opens the opportunities every year. Every year they are opening the new projects. Like just now, they opened a new project in Jeddah. Jeddah have now two projects. One is Muhammadiyah and one is in Feha. So two branches were working. I know a lot of my juniors from the Aga Khan University Hospital. They have also joined this organization. So definitely you can apply anytime. And if your expertise were according to your job vacancy, then of course definitely they will be going to hire you as a clinical pharmacy, as a quality pharmacist, or as a pharmacist. Top three indications, conditions for which medications were dispensed. As I already informed you, top three indications were: number one, heat stroke. Okay. Then second, for the heat stroke, we don't have any medication, but we have the cold compressions. Okay. Then second is the allergic rhinitis. All the patients were coming from the viral infections for the sore throat, and then we have dispensed them the loratadine, and because we are not prescribing any kind of antibiotics there. Okay, because monitoring antibiotics will be very difficult, because the patients will not complete their course, and definitely then there will be a resistance, and then we are not following the antimicrobial stewardship, so we not going too fast. And also primary care setups do not include antibiotic, so that's why. And the third indication would be, I think, burns, because of the high temperature. What skills should I focus from the start joining PharmD as fresh student this year, so that I haven't much problem onward? What skill? See, your skill includes a lot of like, this depends on you, in which field you are targeting. If you are going to become a clinical pharmacist, you need to do some board certifications. Okay. If you are targeting the pediatrics, then you can do the board certification in pediatric. Then we have for adult, you can do in the pharmacotherapy. If you are going in oncology, you can do for the oncology. So there are different pathways that you can select. So board certification will be one of the things, but I don't think so that in the start you can do that. After the experience, relevant experience, you can go for the board certification. Apart from that, the American Society of Hospital Pharmacies are doing a lot of certification courses, so you can check that as well. Then there is an SIGP that they are offering antimicrobial stewardship certification. You can check that as well. So yeah, there are different certifications now. So just do the certifications, and take the relevant experience, apply. So you will definitely be going to consider. Is there any training for the pilgrims on how they should take care of themselves during the duration of Hajj? Take care of themselves? No, obviously no. Take care of the patients? Yeah, of course. They will tell you that they will take a class for you, that how you will deal with the situation if there is influx. They will tell you that you will not leave the clinic, you how you will use the software for taking the information. There are so many influx of patients that sometimes we forget to record the patient record. So this is 84,000 patients in 10 days. I'm just telling you that we recorded. There are a lot of patients that we it didn't even record. So just think about it, that how many patients that we have checked during our Hajj mission. Is there any training for the programs or no? This is I answered. How you manage an appropriateness review and counseling in clinics? Yeah, for the appropriateness reviews and counseling, definitely you have to first check the past medical history for the patients. Okay, sometimes the patient don't even remember that what medications they are taking, because it's a very difficult scenario. And there are the a process of Hajj. First you will have to stay in Mina, then you have to go for Hajj, then you have to go for Jamarat, then you have to come back to Mina. Then for when the people will went through such kind of a things, they of course they forgot that what medications they are taking. They are coming with the altered mental status. Sometimes they are coming with the bruises in the skin, and everywhere there were burns. Okay, so of course, taking the past medical history for the patients, just check the medication dispensation, that according to the appropriate clinical condition, to check the drug interaction. So this is how we are monitoring. And definitely, if we are giving one patient medication, we are not asking them to not come again. Okay, and patients are coming again by themselves as well. But we were also informing them that you can come again, and you have to take the follow up to inform us that whether you were feeling okay or no. So yeah, so patients are coming again, and then we have to check them again. Is fresh pharmacist eligible for applying as a pharmacist during Hajj? Yeah, of course, a fresh pharmacist can apply, but the thing is, you can apply as a volunteer. You cannot apply as a in a Hajj mission. Okay, because the Hajj mission required some expertise that I don't think so that fresh pharmacists could have, like stock controller, inventory management, okay, pharmacy operations. So such kind of things are required. But you can try as from Pakistan, because I'm not sure about Pakistan, but in Saudi Arabia, they're not, never taking the fresh pharmacists. They're always taking the experienced one. Pharmacists working in UAE can join for this services. If yes, how? I think you have to check the Ministry of Health website for UAE. I don't know in which area you are right now. If you're in Dubai, you have to check the Ministry of Health website. I think there were Hajj applications there as well, so you can also join for sure. Kindly discuss the process of applying during Hajj. I have already answered this question before. Is there any asthmatic patient in the crowd? How will he or she be managed by the healthcare professional? For the asthmatic patients, when they are coming, we are usually have the Ventolin spray with us, okay, and Ventolin in inhaler, Ventolin nebulization. We don't have anything. But if we see that after the nebulizations and after the taking the spray as well, that the condition is getting worsened, then of course we have to transfer them to the hospital, because we are only dealing with the primary care. Which one is the best option, master in pharmacy practice or Shifa residency program? Well, I don't know about the Shifa residency program. I have never heard about it. But yeah, definitely residency program is also good. Residency will give you like experience in working in a hospital, so that you can apply directly as a pharmacist. And masters in pharmacy practice, of course, will boost your educational knowledge, and then will definitely be an added advantage when you will apply as a pharmacist in any kind of hospital. What is the scenario of visa processing and all other things? Will the government will sponsor the visa? Yes, the government will provide you the visa, and they will also bear the expenses for your Hajj. That you are also allowed to do Hajj as well. Okay, like half of the payment. What I heard from the pharmacists and doctors working there, that they paid like half of the amount, like 5 lakhs they paid from their side, from their pocket, and 5 lakhs that the government paid for them. I think this is the amount. I'm not sure about the figures. So this is how you have to go, because you are eligible for the Hajj as well. For us, we cannot go because we are Saudi residents and we are not allowed to perform Hajj during the Hajj mission. We have to sign the form that you are not allowed to do the Hajj. If you will caught doing Hajj, then they will cancel our terminate our employment from Dr. Salman Habib Hospital. So we are not allowed. But for you guys, yeah, if you are coming from the foreign country, you are also allowed to do the Hajj. So that's why you have to contribute as well. What advice would you give to fresh family graduates from Pakistan who wants to clear the licensing exams and practice in Saudi Arabia or Australia? Well, there are two different pathways. Australia is different thing, and Saudi Arabia is different thing. In Australia, you can apply as a fresh graduate as well. If you know or don't know, I don't know about it. That in Australia, if you are a fresh pharmacist, you can apply for the internship after doing OPRA exam. There is a two parts for OPRA exams. Like in the same day, you have to complete the two parts of OPRA exam after completing your educational assessment. Then after the OPRA exam, you are eligible for the applying for the provisional registration. After provisional registration, you have two different pathways. Either you can apply for the PR visa, or either you can apply for the sponsorship visa. Okay, for the sponsorship visa, it's very easy that you have to search for the pharmacies in Australia, and then you have to apply. You have to send them your CV, your registration, and everything. And if they feel that you are a good candidate, they will call you and they will take your interview and they will sponsor a visa for you. But for that visa, you have to pay. They will not pay anything for you. So as far as the Saudi Arabia is concerned, for Saudi Arabia, usually only the big hospitals they are hiring the overseas pharmacists right now. They have stopped hiring because pharmacy is a profession which is coming under the Saudization. Okay, so they are completely Saudized this field. So only the Saudis are allowed to join pharmacy as a pharmacist. They are not taking the application from our overseas. But still, like Suleiman Habib Hospital have a different projects opening. So sometimes they're like from if you have a team of 30 pharmacists, from 30 pharmacists, they usually hire five pharmacists from Pakistan. They are not usually hiring the pharmacists from India because India, I think they don't have Farm D for 5 years. They have Farm B Farm for 4 years as well only. So that's why they will not consider the candidates from India. They are not consider the candidates from Philippines. The same issue. Only from Pakistan they are taking. So 4 or 5 pharmacists they will take from Pakistan. If they will take it from Pakistan, they will bear everything for you. Only you have to clear the SPLE. Sometimes even if you will not give the SPLE, they will hire you. Then after coming here, you can give the SPLE exam. After clearing that one, you can be able to continue your job. So two pathways for Saudi Arabia. Either you can apply from there after completing your SPLE, or either wait for the contractual hiring. After you get your contract, you come over here, you can give the SPL exam. Pharmacists are not allowed to check the BP, even clinical pharmacists in Saudi. So should quack practice? I don't understand this. How much we may earn on that 30 days of Hajj if Pakistan pharmacists on visit visa? Well, as I told you before, that they are just paying for your half of the amount. Like if you are coming from Pakistan on the Hajj mission, they will just pay for you like whatever the expenses would be. Half you have to pay, like 5-6 lakhs you have to pay. The rest of the amount will be borne by the government because you will be allowed to do the Hajj. So that's why the government will not pay the expenses in full. While working in Saudi Arabia, this depends on like different time. Like until now, I didn't receive my payment, honestly speaking. So when I will receive, I will get to know that this is also my first experience. Like we had the Dr. Sulaiman Habib Hospital is doing this Hajj thing for last 3 years. So this is my first year that I'm going on Hajj. I applied 2 times before, and my application got rejected because they have very short number of applicants, and they are selecting that on the basis of first of all your nationality as well, because the Saudis will be preferred for sure, and then the non-Saudis number will come. So that is why I cannot go for first 2 time. Only this time I joined this Hajj mission, so I don't know that how much they are going to pay. But yeah, for Pakistanis coming from overseas or Pakistan, they have to of course bear the half of the cost, and half will be borne by the government. What advice would you give to the fresh graduate? For the fresh graduates, I will like ask you guys to complete your certifications and then apply for another country, okay? Because you know the pharmacists in Pakistan are not getting paid as they should. Even in Saudi Arabia they are not getting the good salaries, but if you will consider the other options like Canada, Australia, UK, USA, you will get more salaries. So definitely just do your things, just do your educational assessments. After that, just give the exams, relevant exams, and move to the other countries. This is my piece of advice. SPLE is mandatory. No, SPLE is not mandatory. Even you can start the job without SPLE. Then you can later on you can give it. So it's fine. I think that's all. Any other questions?
Any other questions? Thank you so much, sir. As a freshly graduate, I must say your today's session was very much helpful for us.
Thank you.
Thank you so much, sir. If
Thank you very
anyone
much.
have any question, please drop.
I think we can wait for 2 more minutes. If nobody has any question, then we can leave.
Yes, sir.
Assalamualaikum, sir.
Aslan.
How can you? I have one question. Someone deleted my question. I don't know why. I had one question that you explained sponsorship pathway of Australia. Kindly, can you explain about PR pathway also?
Yeah, for PR pathway, there are two visas actually, 491 and 190 subclasses. These are included in the PR visa. For PR visas, actually, Australian government has made a self-explanatory website, which is very easy to apply. You have to go to the immigration website for Australia, IMI. I think it is a IMI account or something like this. You have to create one account for that one. And if Australia has 6 different states, you have to apply either as a retail pharmacist or hospital pharmacist, and you have to create your profile over there. Okay, after you create your profile, your points scores will be calculated, and if your points scores will up to the mark and above the cutoff point, then the government will send you, the specific government of that state will send you the pre-invite. After you will accept the pre-invite, then your process will be started. And it's a self-explanatory. They will just ask you the documents in the website. You have to attach the documents, and then they will assess the documents, and then definitely you will get the visa. So yeah, it's a self-explanatory website, and you have to apply in the different, I think that's a different broader topic, that how we will apply for the PR visas. But in a short answer, yes, you can go their website and you have to apply for the different states. You have to fill the form there, your score will be calculated, and after that the government will send you the pre-invite if your cutoff score is higher than the scores for nowadays.
Okay, thank you.
Welcome. Yes, anything else? Anything related to Saudi Arabia, Australia, any country, you can. You are
अस्सलाम
free.
वालेकुम सर
Why Islam?
सर कौन से टॉपिक में आपने बात की है सॉरी मैं थोड़ी लेट हो गई हूँ मुझे बिल्कुल भूल गया था
हमने हज मिशन के ऊपर बात की है कि फार्मासिस्ट का रोल हज मिशन में क्या होना चाहिए.
सॉरी किस में
हज हज मिशन के ऊपर फार्मासिस्ट का रोल क्या होना चाहिए, इसके ऊपर हमने बात की. आई थिंक देयर इज अ रिकॉर्डिंग. You can go through the recording after the session, so you can easily
ओके
be
सर
able
थैंक यू
to take it. I think our senior Marine Muzammil is also here. So Marine Baji, if you want to ask anything.
I have one more question.
Thank you
Sorry
so
if
much
it's
for the session. It made us learn how to deal with mass casualties and all these. And we will definitely ask you if we have some more questions if someone is applying for this position. And we hope that you will guide us the same way that you have guided us right now. And thank you so much for your time and contributions. Thank you.
Thank you so much, ma'am. Yes. Anyone else? I think that's all, Aisha. We shall wind up the session.
Yes, sir. I think you have answered all the questions.
Yes.
So we should leave.
Mhm.
Thank you so much, everyone. Thank you so much, sir.
Thank you so much. Thank you.